Welcome to my QWO journey, months 1 through 3. I'm going to share with you the good, the bad, and the ugly, and I'll tell you, it's been mostly ugly. So, full transparency, I'm not a happy camper. I'm not happy with Endo. I'm not happy with their lack of transparency, and I want all of you who are considering this procedure to be warned about what may happen to your skin and the lack of accountability that the company takes when you reach out to them for help and you ask them what can be done, what should be done, what the best leaders are to solve the problem. So let me just get right into it. Welcome to my first video on QWO, the injectable cellulite treatment. The very first injectable cellulite treatment approved by the FDA in 2020 by a company, manufactured by a company called Endo. The theory and process behind it has been out there for a number of years to treat different types of conditions. So the idea was to use the same product, but for a different use. So essentially, QWO is injected in the middle of a cellulite dimple, and then it's injected multiple times at a lesser depth around the dimple. So what happens is between 12 and 24 injections is what you'll have, depending on how much cellulite you have, and it's for moderate to severe cellulite. So it's supposed to help. If you see photos, you'll see the before and after. We'll talk about that in a bit, and what my experience has been. So I went into a plastic surgeon's office with an injector who had said she had done the procedure about 800 times. Okay, so since it was approved, that's quite a lot. And really didn't have too many reservations. She didn't bring up any issues. She just marked the spots. We looked together in the mirror. One thing that's really important is that you do not want to mark areas of laxity. So they can tell, is it a true cellulite dimple or is it laxity? You can tell by pushing up and even down, right down, and sometimes up on the area and seeing what the result of the skin is. Does it fold over or does the dimple get enlarged? Does it disappear? So your injector should be doing that. They know what to do. They've been trained. I've actually watched the training videos and did get access to them. It's a pretty straightforward procedure. It's approved for the buttocks, for the butt. Simple. Is it used on the thighs? Yes, I had it on the thighs as well, but it's a more diluted product that gets put into the body. So when it's injected, the idea is that it will break down the collagen. But keep in mind, we're always trying to build up collagen, right? This is going to break down the collagen that holds the septi, the bands, together. So the collagen bands essentially sit tight, and then what happens is as we get fat above it, it sits in and out of the bands, which causes that dimply look that most of us really hate. So no matter how much I weighed, whether my BMI was 17 or 22, even when I was 16 years old and I weighed 95 pounds, I had cellulite. And that's common. You'll see athletes that have it. About 85% of women have it. It's often genetic. It will get better or worse with body fat percentage. So certainly that also plays a role in making it look better or worse. But whether you have it is usually genetic. I hated it. I wanted to get rid of it. New treatment. It's not as invasive. You don't have to go in with instruments and cut the bands, which is an alternative option. Sounds like a good deal, right? So I went in, did my homework, found an injector. Now keep in mind, I had 24 injections. They're supposed to be spaced out 3 weeks apart. To be on the safe side, my plastic surgeon does them 4 weeks apart. Give you a little more time to heal because the bruising is intense. And I'll talk about what it's like right after. However, unfortunately, I have not had a good experience. And I have had zero response from the manufacturer, reaching out to them myself. My plastic surgeon gives me an occasional response back from them. I'm not even entirely sure that they're responding to them. And thankfully, I know someone at a med spa who has been kind enough to ask their rep about my case and get a little bit more information. Now, there are a whole host of side effects. Among them is bruising. And when I say bruising, you'll see the photo here. I mean bruising. It is, I went to a massage a couple of days after. And the lady literally went, ah! And that's not a joke. She scared the crap out of me. And she said, what happened? And she thought I had a motorcycle accident. Many people who saw the bruise thought, including physicians, thought something very serious had happened. The bruising is intense. I cannot describe to you the eggplant color and the level of soreness. I don't care about that. It's fine. It's a bruise. It'll go away. Except it didn't. Mine caused hemosiderin staining, and it's more common, reported online by people that the company never responds to. I rarely see anything but the threads shut down on RealSelf. And they say 8% of people will have staining. Okay, even if I was only one of 8%, 8% or one part of the 8%, what is the solution? What is the solution? They don't have one that they publicize other than wait it out. Some people have said that their staining never went away on RealSelf. Those threads are shut down after a couple of responses from plastic surgeons with different ideas on lasers. There are some med spas and even some plastic surgeons that say that they use anti-bruising treatments right after the first couple of days of QWO to help reduce the bruising to lessen the chance of staining. My surgeon didn't do that, probably should have. I have been treating it aggressively, so just full transparency, I paid $4,500 for 3 sessions. I've only used 1 session. I'm not doing the other 2 sessions until the damp staining is gone. And, by the way, it made my cellulite look way worse. Is it a shadow from the staining? Maybe. I don't think so. And the cellulite, by breaking down those collagen bands, it actually caused laxity that was not there before, and my butt has sagged, and the same thing with my thighs. That's what I believe is happening so far. I should have already had my other 2 treatments. I've had 2 different opinions. Plastic surgeon says that the representative says that I need to wait until the staining is gone to have 2 and 3 and that it won't matter. So I have not yet gotten a refund. The representative for the med spa says she should just have 2 and 3 right now and deal with the staining at the end. That way she's not losing the benefit of having them in rapid succession. The staining is the bruising is supposed to get better with 2 and 3, injections 2 and 3. Why? Because the more bands that are broken down, those bands are full of blood vessels. So as they break, the blood vessels shatter and the bruising is astounding. The bruising is astounding even at the 3.5-week mark, as you'll see from my photos. 1 month I started calling my surgeon and asking for help. What was I going to do about the stain? What appeared to be staining? They said, don't worry, you don't have dark skin. It's not staining, it's staining. It is hemosiderin staining, which is iron that what it means is there was such bad bruising that the body couldn't clear all the iron from the blood out from between underneath the skin. That's how intense hemosiderin staining is. So my plastic surgeon gave me I think it's called transischemic acid. It's a pill to take, huge pill, did nothing. I asked them, do you have the laser that other people say works? They don't have it, which is a tattoo removal laser. Very much, by the way, this process is very much, the staining is very much like tattoos. It's what it's compared to by other plastic surgeons. And even the manufacturer, on occasion, I have seen little statements. I don't know if it's directly from them or just referencing them, but that it's similar to a tattoo. So, anti-tattoo lasers apparently help take it away. So I have had 2 rounds of Genesis at my own expense. I have had another round of anti-tattoo laser only on one side, tattoo removal laser, on one side, to see if it helps, because it's a little bit more intense, a little more painful, a little more invasive, to see if it helps get rid of the stain. So you'll see in my pictures let me describe first what it was like right after. I didn't really feel much. The sting is less than Botox, not a big deal. 15 minutes later, I was out the door, sitting in my car. About an hour later, started to feel uncomfortable, squirming around a little bit. Then I got more and more uncomfortable, down to the point of painful to sit. I did not want to sit and continue to drive around. It really hurt to walk. I wanted to go home and lay down, but laying down hurt. It's painful. As you'll see from the bruise, it's hard to get that kind of bruising and not have some pain. But that would be okay with me if the darn thing worked. If it didn't make the cellulite worse, and if they had a solution for the darn staining, which to me, it's not a trade-off. You can't ruin someone's skin with an 8% chance way on the bottom of their website, by the way, of side effects, and then specifically saying that it affects dark-skinned people primarily. I do right now have a baby tan from being in Hawaii, but it does not affect just dark-skinned people. And they're not trained to use lasers right after the procedure, which is what should be done and what many other places have done. That on their own, by the way, they figured it out on their own, and you can research this yourself, where the estheticians have researched and figured out on their own how to help reduce the staining, because their patients or clients have also had staining. So if you're considering QWO, just know that your skin may suck after, like mine does. I am embarrassed. Being out at the pool, I have to just not think about it. You'll see my before pictures. And I had cellulite, absolutely. That was not as embarrassing as worse cellulite plus staining. The answer of it'll go away with time, but we don't know how much time, literally is what the rep said to the med spa, but we don't know how much time, is not acceptable. The company needs to do their job and tell people who have had this procedure what they need to do very specifically to reduce and remove hemosiderin staining when it happens and own up to this freaking problem. There are a lot of people reporting it and it gets shut down. Why is that happening? It's not just it's technically, is it cosmetic? Will it do any harm? No. There are people out there saying, let's just not eat iron so our body takes it from the underneath the skin. Really? We're having to come up with our own off-the-wall solutions because the company is not owning up to the problem? They need to post and respond to us who actually email them and take the time to find their Twitter, their Facebook, and every other method to contact them and tell us what the heck to do to solve the problem. So back to, sorry, I get very angry about this when there's not full transparency from companies and they will not respond to patients. It's completely unethical in my opinion. And we'll see what happens here as time goes on. Maybe it will just go away. When I go back and look at my photos, does it look better than a month ago? A little bit, yeah. But I've also been aggressive with lasers, which is a totally separate expense than $4,500 for 24 injections times 3. So day of procedure again, pain, a few days later pain. Started to get a lot better, even though the bruising is intense. It was intense until the end of the second week, and it started to lessen a little bit. It turned all the normal colors that bruises do, but 1 month later, I did still have some light bruising, which turned into staining. And at that point, I stopped my treatments. I did not continue them. I'm continuing to see the lady that I trust at the med spa. Plastic surgeon's office, as I said, they do not have the lasers, so how are they going to treat it? If they don't have the lasers to deal with it, how are they going to treat it? The only option is to pay out of pocket elsewhere. So will I eventually do treatments 2 and 3? I don't know. I think the cellulite looks worse. I haven't gained any weight, by the way, since then, as you'll see in the before and after, but it looks worse. And I have been very diligent in going to the gym. I waited about a week and a half until some of the bruising went away and I wasn't in pain, and then I hit the gym just like I normally do. And so that is where I'm at the end of the 3rd month of QWO. Staining, worsened cellulite, and I will be continuing laser treatments. I have another one, so the beginning of the 3rd month I'll start another video. Another round of laser treatments coming in about a couple of weeks. I had timed this, by the way, for a trip overseas where I really wanted to be able to wear a swimsuit, continue my work in the gym, and not have cellulite. And unfortunately, things are worse. So that has been my QWO journey so far. I just want to warn you ladies that if you are considering this, read through their list of side effects and know that the small chance very well may be you, and make sure you can live with it. Get an answer from your injector on how they will deal with each one of the side effects if it happens. By the way, my injector never brought up staining to me. I asked her, how many patients have had staining? And she said about 2, but they were dark skinned. So there seems to be this sort of, if you're dark skinned, you'll get it, and if you're light skinned, you will not. That is not true, as you will see from my photos. So I wish you ladies luck if you're undergoing QWO. I'd love to hear your comments. If you've done it, I'd love to hear what you think. Maybe you had a great experience. If you did, I'm grateful for that. If you have ideas on how to deal with the staining, I'd love to hear them. This is a topic that's difficult to talk about, obviously. It's not fun to take pictures of your ass and your thighs and see how they look. But I am doing this literally because I have found nothing out there, nothing that talks about what happens when this goes wrong. The lack of response from the company, and even the surgeons. We don't have that laser. That's not an answer. You know what? Get the damn laser. Send me to someone, and you cover the cost that has the damn laser. The companies who are the surgeons and the dermatologists and estheticians who are doing this work, they need to have this available to us when something happens or goes wrong, or refer us to someone who can. And it's not ethical, in my opinion. Again, I won't go off too much on this. It makes me very angry, as you can tell. Many of us want to better ourselves, we want to look better, we're willing to try treatments. It has been 2 years since it was FDA approved, nearly 2 years. It's enough time to try it out. And somehow, miraculously, either no one's having the treatment, which I highly doubt, or the questions and answers get shut down. So is it a conspiracy theory? Maybe. Is it my opinion there's something else going on? Yes, it is. We'll see if this video gets taken down too, by the way. So yeah, that's been my experience. This is only my experience. I am a research professor. I'm not an MD. I'm not an esthetician. I'm not a plastic surgeon. So if you're watching Endo, you have a very educated consumer that's very upset, and you need to go to your Twitter and your Facebook accounts and also your email and look for my messages, as well as I'm sure countless others who have not gotten a response from you about what to do when things go screwy with your solution to cellulite. Again, ladies, good luck. I will be posting again month 3, month 4, month 5 separate videos for 3, 4, and 5. I hope to report back good news. I hope to tell you in July, staining is gone, I'm proceeding with treatment 2, because they do say that after 1 treatment you don't really get any benefit. You need 2 and 3. I'm hoping to be able to tell you that that's the case. I am crossing my fingers, but I wouldn't make any bets on it at this point. So yeah, that's my journey so far of months 1 through 3, and I'd hope to have better news by the end of the 3rd month. But I had my injections, by the way, February 11th, of 2022. So when you look at the videos, you will see that yeah, it's been a solid 3 months. I should have been done and over, not still dealing with problems from month 1 or week 1. All right, I'm going to shut up about this now. I think you can tell I'm frustrated enough. I hope this does help some of you. That's the whole point. Not just to air my frustrations, but I hope it does help some of you make a decision. Maybe this needs a bit more research and a bit more clinical outcomes before more people do it. Maybe, I'm not going to say we should rethink how we think about our bodies. Personally, I think if you don't like something about yourself, go fix it. This seemed to be a decent way to do it. And many of you may comment, I'm sure, and say that, I should just love myself the way I am. I do. But there's nothing wrong with self-improvement, and we all have our different opinions. I'll respect yours, please respect mine. Please be respectful to other people in the comments who might also be interested in the procedure. And I will share with you my journey, what's been happening, as I promised. So again, difficult subject. No one wants to put their underwear on and show a video of themselves. So please be kind to me. Thank you so much. If you want to continue to follow this journey or my other beauty, cosmetics, injectables, and so on, please hit the subscribe and notification bell, and you will be notified when the new content is posted. Thank you so much.